From the first moments of life, we as humans are in danger of contracting a series of diseases. New York-based Dr. Philippa Cheatham talks about the importance of newborn screening tests, which are administered during the first 72 hours.
Newborn screening are a group of tests, blood tests, as well as physical examination of the newborn to look for diseases before they actually present with clinical signs. So we're looking to detect diseases, developmental diseases, genetic diseases, metabolic diseases that can affect the newborn child. We want to pick these diseases up early before they cause harm to the newborn baby.
Blood is drawn from the baby's heel and sent to a lab. The first test determines which newborns are at risk, and the second, the potential diagnoses.
Some of the health dangers that we're looking for with newborn screening, we're looking for congenital abnormalities that may affect the heart, they may affect the eyes. We're looking for hearing abnormalities. There's very sophisticated tests that we can do on the babies to assess their hearing. We also examine the hips to pick up congenital abnormalities of the hips. In newborn males, in baby boys, we're looking for abnormalities of testicular development, and there are blood tests that we do as well.
Without the newborn screening test, Dr. Melissa Wasserstein says parents and professionals alike may never be able to ascertain whether a child even has any symptoms.
Most babies who have these diseases are completely normal looking at birth. They look like every other baby in the nursery, and in fact they act like every other baby in the nursery, so you would have no idea that this child might have one of these rare diseases.
Although the screening tests are administered worldwide, there is still a discrepancy between first and third world countries, as these tests and the following treatments can be very expensive.
The amount of screening tests that we do have increased in number, have become much more sophisticated. We've been screening since the 1960s, so these screening campaigns have really raised awareness. And in the hospital, it's standard protocol. But for babies that may be born in the community, it's important for mothers to follow up with their midwives, with their paediatricians, to check that the babies have been screened. And if there are genetic abnormalities that run in the family, then it's important to let your doctors know about these.
But even those newborns with a clean bill of health in the family may be at risk without this screening diagnosis.
This person has a completely normal copy of that gene, so they're healthy and well, and they have no idea that they're carrying this abnormal copy. In the very rare chance that this person happens to have a child with another person who also has an abnormal copy of that same exact gene, they are at risk to having a baby who inherits both copies of that abnormal gene. And this child might have a genetic disease. They don't have a normal copy of the gene like their parents do.
Now, only 1% of newborns are actually diagnosed with congenital heart defects, but medical professionals recommend that parents keep in touch and follow up with their pediatricians, as the first few months of life prove to be the most critical. For Saudi Good Morning, I'm Shruti Mathur reporting from New York City.